Hello, my name is Nelly Hernandez. I am I don't like to say patient, but a regular here at Pancake Health Center. Actually, it's going to be 2 years, I believe, coming up in January, of regular treatments. I have, just to give you a little background before I get into the main topic, is I have severe fibromyalgia, chronic fatigue syndrome, by many doctors confirm it, and the final authority on confirming that it's severe was Mayo Clinic in Jacksonville. And so that's a separate issue. On top of all that, I was having just problem of all my body, having, as you know, with fibromyalgia, it's generalized pain everywhere, but then there were joints, a problem like both of my hands and elbow, my knee at one point. So I have x-rays of my whole body, basically my whole joint area of my body. And it was like around 6 months before I actually said anything about a problem I was having on my right shoulder, because it was just so much to bring it to the attention of the doctors or even my own family. But I couldn't use this right shoulder if I went like this, if I went like this, if I went like that. And I was so limited, and the pain was so horrible. After 6 months or so, I decided to have x-rays because I said, this is not normal, it's not going anywhere. It was just getting worse. And so they did the x-rays, and I came back with calcific tendonitis, actually twice. They've confirmed it twice, calcific tendonitis, and even with anti-inflammatories and things like that, it wasn't getting any better. So couldn't do pretty much nothing. At one point, I had to be rushed to the hospital because even though I wasn't using it for a whole week, this pain was so severe from here that it would vibrate all the way down. It was horrible, and the pain was just like I was in tears all the time. When I went to the specialist, the orthopedic doctor that was checking my whole body pretty much, they don't know what to do with me because, again, the fibromyalgia, all the specialists agreed that I'm not one for surgery because any surgery would just complicate stuff for me. And so they didn't know how to handle, what to do with me here. What they explained that they would try and do was no guarantee, and it was going to be very painful and complicated. So we agreed that my daughter, that obviously worked here at Pancake Wellness Center, also suggested to my doctor that she would try Pulse, this machine right here. She would try pulsing before to see if it would help me, so I wouldn't have to do that other scraping procedure thing that they were talking about. And so we started the pulsing, and with just 2 treatments, believe it or not, and it wasn't consecutive, I was able to rotate my arm a little better. Then I continued doing it, and believe it or not, more rotation. I can do this. Notice it's not all the way, but look, before I couldn't do, this is the most I could do. I could not do the back at all. And I could not reach this way at all. That was just daily limitations, and if I went to pick up something higher up, I just couldn't. So I seen the benefit of that. So now we had to focus on my feet, because that was the last part of my body that specialists needed to figure out. I had a lot of problems going on my feet. So I went to see a podiatrist, and she came back with the x-rays saying I have a varieties of issues in there. One of the worst problems to handle is that I have neuromas, little tumors surrounding my nerves on my feet, and that's very painful. So when I stand, I can't stand too much. I can't walk too much. But on top of that, I have other problems on my feet. But we're trying to focus on how to dissolve those little tumors around the nerve so I can get a little relief. And wouldn't you know it, the pulse. I've been pulsing, so basically I'm pulsing my whole body. I've been doing the feet. I do both shoulder. The lower back, that's a problem. My head, because I have a problem here in the liver area also. But my feet, I'm being able between the insert, between icing them, and between a whole bunch of other stuff. But this helping dissolve the little tumors that are surrounding the nerves At least I'm not getting that pain up here that I used to get whether I use my feet or not. Pulsing, you wouldn't know it, and it's electromagnetic fields therapy. She's going to point it to it. It's amazing. It's good for so many things. And my testimony is that, again, I'm able to use this shoulder more just using the pulse. I've been doing it only once a week, although my doctor, Dr. Pancake, recommends twice a week. I can only do it when I come to my sections every week. I do pulse before he treats me, and I've seen the effect. And there's a variety of conditions that it helps, and that's my testimony. It works.